what I can say is that the community health center model has worked. It's been, despite all of the political ups and downs in our country, there's been a fairly consistent bipartisan kind of support for it, because it brings healthcare to communities all over the country, both inner city and rural healthcare. And what has survived really from the 1960s in the original OEO models and neighborhood health centers is the community governance. So that when I was working in a farm worker clinic, I reported to a board that was 51% consumers, patients who use the services, low-income individuals who are of the community that we were serving, and they could hold me directly accountable for the care that I offered. They could make sure that it was culturally appropriate and linguistically appropriate and all that stuff.
And what have you learned in terms of the economic efficiency of targeting those kinds of communities with a community health care center?
It's a way to get the right care in the right setting at the right time.
Right.
In other words, the impact just on emergency room visits is profound. And so if people are not able to connect with a patient-centered medical home or a patient-centered health home, however you want to call it, then they're left to access care that may be inappropriate, going to the emergency room for ear infections or things. When simple, timely access to good quality primary care, having a continuity relationship with the provider, having a team-based approach to care that allows folks to feel like they really do have a place to go. And then if they need more high-tech care, more specialty-based care, even hospital-based care, there's an appropriate coordinator of that to make sure that it's used when it's needed, not inappropriately.
And what do you think the American system can teach the Canadian system of consumer or community health centers and vice versa?
I think we have much to learn from the Canadian system. I stretch a little farther when we talk about the American healthcare system, because we have been kind of fragmented, and we do have a tremendous amount of inequities, both on an income level and insurance status level, as well as on racial and cultural domains. We have many inequities in those kinds of health outcomes. So perhaps just paying attention to those is one thing that we bring to the conversation. I do think that community governance is another area where really being willing to be held accountable, being willing to let the community be your boss, is another area. The community health worker models that have grown out of international village health worker or promotora type of models as part of the primary care team instead of being a standalone community health model. You know, Canada has a wonderful opportunity in managing the in-betweens we talked about a little bit earlier. In that connection between the emergency room and the primary care center, or the discharge from the hospital, a referral back to the primary care home shouldn't be a fire and forget missile. You know, here's the number for the clinic, good luck and God bless you, and I hope you get your appointment. If there's a much better set of transitions and continuity between those different places of care, we can often achieve much better outcomes as well, and people don't fall through the cracks.
Thank you very much for sharing that.
Yeah, thank you.